Hi, I'd like to introduce to you this afternoon Terah Ryan. She is the, what is it?
Care Services Coordinator.
Care Services Coordinator for the Virginia, Maryland, and DC chapter of the ALS Association. Terah, tell me what you do.
So my role is to bring our chapter services to patients diagnosed with ALS and their families. And I work with a really incredible team of care services coordinators and assistive technology specialists, of which Regan Flores is one of the assistive technology specialists. And together we cover our entire region, so all of DC, Maryland, and Virginia. And I personally cover Northern Virginia.
Okay. Now I understand that a lot of ALS Association chapters are involved with ALS clinics.
Mm-hmm.
How does that work?
So we help to support those clinics with funds, and that's a joint effort between our chapter and the national office of the ALS Association. Across our territory, we have 9 of them that we support.
Within the Virginia, Maryland?
And DC.
9. Where are they?
So, what's in Virginia?
So we have 2 in Virginia Beach area. We have 1 in Richmond, Virginia, VCU clinic. We have 1 at UVA clinic. And then we have 2 in DC, Georgetown and George Washington.
Uh-huh.
Then we have 1 at UMD, and then we have 1 out in Salisbury. And then we also do Hopkins. We fund Hopkins.
Wow. Now, how many chapters are there nationwide? Do you know?
38 active chapters.
And tell me about the UVA one, because that's where I go. Do you know the name of the person who coordinates down there?
So our colleague Jennifer Mundy is the care services coordinator, and she's actually our clinical director with our chapter, who works as the association rep at that clinic.
Now, she said to us that you actually involved with the GW. What is the relationship between a care coordinator and the clinic?
So it really is to bring our chapter services to those folks, and it's also to be a support in the community. So we have this unique capacity to be out in the field with families, whereas many of the clinicians who you would see at clinic don't. That's not always true, but we do have the unique capacity to visit your home and be connected with home care providers and be a resource in that way, in addition to bringing the chapter services that we offer.
So if I needed home care, you'd have recommendations?
Yeah.
And here's the $64,000 question, literally. Do you have any ideas of how to pay for that?
It's tough. Medicare is not currently covering that, unless you are also receiving some sort of in-home therapy, and even so, it's just a couple hours a week. It's not much. Folks who are covered by Medicaid tend to have a little bit more support with home care in terms of a home health aide in their home with them. Otherwise, it's an out-of-pocket expense.
Yeah, I've been doing some research on that, and that's what I found too.
Yeah. There also is the option for long-term care insurance, but that's usually something that you select way in advance prior to diagnosis.
Yeah, Regan, I understand you are involved with assistive technology.
That is correct.
Tell us all about that.
Mm-hmm. So anything dealing with communication or environmental controls, so simple communication methods, environmental controls as in controlling your environment using Alexa, smart plugs, or if you notice any changes in your speech and you need a different way of communicating, we have eye gaze devices that you use, text-to-speak apps on tablets, iPads, your smartphone.
Now, how much does that cost people if they're involved in that?
It's a good question. So with our chapter, we offer a loan closet program where so we have equipment in our loan closet. If it's available at that time, we are able to loan it out to our patients who are registered with our chapter.
Okay, a few months ago, I was having difficulty with my keyboard, getting my arms up there. So I bought a wireless keyboard, and now I'm actually having difficulty wiggling my fingers. How do you think I can solve that issue, if I can, going forward?
Right. So there are different ways of accessing your internet, computer. So, for instance, there are handheld mouses. So with a handheld mouse, you can turn on an on-screen keyboard on your computer. And so instead of having to type, you can just use your thumb to control the keyboard and control your whole screen. But all you're doing is holding it down in your lap where you're comfortable and using a little bit of movement.
And how much does that cost?
We actually have it in our loan closet.
Oh,
So
really?
yeah, so today you can leave with it. But
With the software as well?
there's no software.
So where does the keyboard come from on the
It's-
screen?
So that is through settings. So on your computer, you would have to turn that settings on.
Huh. So in that case, do you have an instruction booklet and everything like that goes with it?
Not necessarily, but I can walk you through the process over the phone. I can come out to your house to set it up and help train you on it. But yeah,
Wow.
that's me.
Oh, fantastic.
Mhm.
Now, concerning ALS Association by itself, on our next segment, I'd like to talk about the ALS Association and where it goes nationally. Okay?
Okay.
Thank you so much indeed.
Thank you.